Robert, John, Stacy, and Patricia all live with chronic health conditions. Robert has type 2 diabetes and cardiovascular disease. John has chronic pulmonary disease. Stacy lives with obesity, and Patricia was diagnosed with heart failure a couple years ago. Despite their very different stories, they all have one thing in common. They've had to learn to partly manage their conditions themselves, with the help of their family, friends, or with support from their community, and of course, healthcare professionals. This practice is called self-management. It helps improve patients' quality of life while reducing the burden of chronic diseases, may contribute to decrease/lower the healthcare costs. But self-management is not as straightforward as it may sound. There are many ways to conduct self-management interventions, and it can be very difficult to identify the best one for each specific situation. This is where COMPAR-EU project comes into play. COMPAR-EU helps to identify which kind of self-management is most effective given a certain situation and disease. COMPAR-EU was fully funded under the European Commission's Horizon 2020 program. It brought together researchers and patients from 7 organizations across 6 countries who identified, compared, and ranked the most effective self-management interventions for people like Robert, John, Stacy, and Patricia. In total, our researchers screened over 41,000 articles on self-management and analyzed in detail around 2,000 to see how they work for different chronic conditions. Then, with the help of experts from all around the world, we identified 132 key elements of self-management interventions, or SMIs, after going through close to 300 systematic reviews, and grouped them into 4 categories: intervention features, self-management behavior, also called interventions, results to measure and compare interventions, and population to which the intervention is addressed. In this way, we created a common language that can help to better understand and create future research. From there on, the project team created a set of tools for different audiences. Say, for instance, that you have a chronic health condition, like Robert's, John's, Stacy's, or Patricia's. You can use our platform to look for information, facilitate discussions with your practitioner, and decide on the best course of action. You can be fully confident in this process as it was co-developed with patients and patient representatives just like you. The COMPAR-EU patient panel had a say in all major project outputs, from design to completion and from execution to validation. Our other tools are aimed at groups like researchers, decision makers, healthcare professionals, and managers. Policymakers and managers, for instance, can use our recommendations to decide which self-management interventions, SMIs, should be considered for implementation. Healthcare professionals, on the other hand, can easily identify the most cost-effective SMIs, the most effective elements of self-management, or even identify the factors that can facilitate or hinder the implementation of specific SMI. All in all, COMPAR-EU contributes to a brighter future for people like Robert, John, Stacy, Patricia, and their loved ones. But it goes even further by paving the way to future policymaking and research. Want to know more? Check out our interactive platform on platform.self-management.eu.